Hey everybody, I'm here with Dr. Timothy Katzen at J. Timothy Katzen MD. You can find them at beverlyhills.timothykatzenmd.com. So we're here to talk about cosmetic surgery and some of the exciting new treatments and procedures out there today. So Dr. Katzen, thank you very much for joining us today. I appreciate it.
Thank you for having me. My pleasure.
Absolutely. And I wanted to start off just by asking how long you've been working as a plastic surgeon.
Yeah, so I've been in private practice here in Beverly Hills for about 22 years.
Okay, awesome. Was there anything in particular that made you want to get into that space and help people with their cosmetic goals?
Yeah, so plastic surgery is a lot about helping people sort of achieve what they want, whether it's cosmetic or the look or the feel, but that's what a lot of what cosmetic plastic surgery is about.
Okay, definitely. And I was curious to find out from you, have you noticed an increase in patients coming back in for procedures since the end of the pandemic?
Definitely, yes. So even during COVID, the number of people seeking plastic surgery off the charts. And that's pretty much nationwide. Plastic surgeons noticed a significant uptick. I, bump into many plastic surgeons during the pandemic and after the pandemic. We're literally saying they're the busiest they've ever been in their whole career. And that's certainly true for us. In the past 20 years, COVID sort of made the cosmetic industry extremely busy.
Yeah, and I think that might be part of, with what we're doing here with the Zoom calls and everything, and everybody kind of seeing their own faces all the time and thinking a lot more about it.
Exactly. So during the pandemic, a lot of people were at home. They were maybe not spending as much money as they were on going out, restaurants, entertainment, tours, things like that, trips overseas. And they sort of turned around and said, well, what else can we do? And they were turning to plastic surgery. So a big industry boom during COVID, and especially even after COVID now.
Yeah, absolutely. And what are some of the main procedures that you focus on there at your practice?
Yeah, there's sort of three areas that I focus on. One, it's called after weight loss. So I have a lot of patients who have lost at least 100 pounds or more. And I come in and do things like tummy tucks and body lifts and thigh lifts and breast lifts and arm lifts. So pretty much patients that have lost a lot of weight, massive weight loss. Another niche that I do is, unfortunately, a lot of people have had silicone injected into their buttocks, injected into their breast, other parts of the body. And the silicone is now causing major problems, pain, it's killing the skin, it's migrating. So I take the silicone out. And the third area that we focus on is what's called Vaso Liposuction, which is basically a type of liposuction that uses ultrasound frequency to melt the fat. And I can get you a six-pack, I can get your biceps and triceps, really built out arms and tummies just with using this tool and the special way that I do liposuction. So it's called Vaso High Def Liposuction.
Okay, definitely. Yeah, that's awesome. And with that one in particular, how long do the results typically last with that? And then do you recommend any, follow-up services to help maximize those?
Yeah, so in terms of the Vaso liposuction, I mean, as long as you continue to eat right and exercise, those results are going to last you a lifetime, okay? Because we chisel out the fat that's around those muscle bellies. So if you eat right, exercise, those results could last you forever. Yeah.
Fantastic. Yeah. And then the results with that, or sorry, more of the benefits of that. And obviously everybody wants to be able to look a little bit better and have some more definition there. Is that what most people go for?
I've never met a guy who doesn't want a six-pack. So all my male patients, they all want six-pack. Females want more definition to their abdomen. Some women want the vertical lines, the linea alba, semilunaris lines on the side. Some go all the way and make that six-pack. So with female patients, I can sort of, guide what they want and create what they want based on the lines that they want to have.
Okay. Yeah, that makes sense. And what's the average surgical time or recovery time with that procedure?
Yeah, the Vaso High Def typically takes me about 3 to 4 hours. So 3 to 4 hours on the table. And then the recovery time varies from every patient, but usually it's going to be about a week to 10 days. If you have a very physical, active job, maybe you're moving things around 50, 100 pounds, et cetera, maybe you want to take off 2 weeks. But usually if it's this desk sitting type job, look at maybe about 7 to 10 days.
Okay. Yeah, that makes sense. And then, obviously with, instruments and different techniques coming such a long way over the years, obviously that's given way to, procedures like that being available. But obviously there's still a level of expertise required with that, correct?
Absolutely. So in plastic surgery, I go with the instruments that have been around for years and have sort of proven their worth over time. We always get the patient coming into the office, especially Beverly Hills. Oh, they've been doing this for 3 months in Europe. Well, I'm like, yeah, but they don't have enough data or patients to show that this thing works.
Right.
The Vaso machine, on the other hand, the Vaso machine has been out for about 30 years. It's on its 3rd generation. It really works. But there is a learning curve to it. You got to know what you're doing to avoid mistakes, but it's definitely a machine. It definitely works, but in the right hands, you've got to choose your right doctor to get the good quality, high def results.
Yeah, absolutely. And who would you say is really the ideal candidate for that procedure?
Yeah, ideal patients for the Vaso high def are going to be healthy, they're at an ideal body weight. They don't smoke, don't have other medical problems. If you do have maybe hypertension or diabetes and they're controlled, you can still have the procedure. But you've got to be ideal body weight and sort of, conscientious about your look and your physique. Because after the results, we don't want you to say, oh, I just had this procedure. Now I have a license to drink Coca-Cola and eat potato chips on the couch. I mean, it's a tool to get you where you want to be, but then you've got to maintain the results by eating right and exercising.
Yeah, absolutely. I could definitely see that. And then you mentioned a little bit about, finding and making sure you have a surgeon that really knows what they're doing with that. How long have you been performing that procedure?
So I've been doing the Vaso high def for about 22 years now. And in terms of training, I used the first Vaso machine that they produced like in the 1990s, sort of in there. And every generation that they come out with the machine, it just gets better and better. And the way is to sort of tell if your plastic surgeon is sort of qualified and knows what they're doing. I think the best way is go on their website and look at their pictures. I mean, they can say and write and do all these blogs and everything, but unless they have sort of proof in the pudding, if you will, pictures on the wall of these are some of my patients that I did this Vaso high def, that shows you, look, I've done this procedure before. These are results you can expect.
Yeah, absolutely. Okay. And then lastly, is there any advice you have for a patient that's, thinking they might be a good fit for it and want to know what their next best steps are?
Yeah, so basically, if you've been at the gym for hours and hours and you eat all the right things, high protein, no carbs, no sugar, don't drink alcohol, anything like that, and you just can't get that 6-pack that you're looking for, you may want to consider this procedure. Because, literally it gives me about 3 hours in the operating room and I can get you 6-packs that may take years in the gym to get. So if you're in that situation where you're in the gym and you just can't get the 6-pack that you want, you may want to consider this Vaso high def 6-pack.
Okay, definitely.
It's a really good surgery. Yeah.
Yeah, absolutely. It sounds like it. And what would be the best way for a patient to get in contact with you guys?
Yeah, you can always call us 310-859-7770. Also my website, TimothyKatzenMD.com. And you go on the website, go through the gallery, check out the before and after pictures. We do consultations either through Zoom, Skype, WhatsApp, FaceTime, or traditional, you can walk in the door and we can see you physically. Of course, before we do any surgery, we're going to check your labs, EKG, chest x-ray, and we're going to meet you in person several times before we do the surgery. So don't fear that you won't meet me before the surgery.
Yeah, absolutely. Okay, perfect. Well, thanks so much for taking the time to share the information with us and give us that education. That was great.
Sure, my pleasure. Thanks for having me. And if you ever need any questions answered about plastic surgery or Vaso high def, give me a call.
Yeah, absolutely. All right. Well, have a great rest of your day, Dr. Katzen. Thank you.
Great. Thank you very much.